So looking at the insertion for a minute. So again, we talked about the inserter. This shows just an acute probe mounted on it, but again, we can use this for anything. It's really important for the matrix, and we spent quite a bit of time actually studying the insertion space. So we wanted to optimize that as best we could. And we did a study, 118 insertions, looking at using our inserter, so looking at the speed. Well, I'll get into it here. I'm kind of getting ahead of myself. This was an early study we did several years ago looking at just the effects of insertion on brain slice. The point here is we're tracking certain features optically, but you can see, as the brain tissue compresses, these migrate. And so this was a benchtop study, and the outcome of this study, the outcome was to determine the optimal speed for sort of minimizing dimpling, minimizing drag, and the outcome was about 2 millimeters per second was the speed. So then that was several years ago. That was published. Then we took that into the context of the matrix and the in vivo implantation. Just here's a series of we were trying to minimize dimpling is what we were doing. This is just a time series of insertions. So again, we did 118 insertions. The other parameter that we were looking at was the tip shape. So we explored different tip angles and different levels of sharpness to find sort of the sweet spot as far as that goes. And that's what we're producing. All the matrix arrays now have the best tip angle that we found out of this study. But again, this is what we were trying to avoid. You see this level of dimpling here. This is a nice clean insertion here. We were measuring force, so we had a force transducer on the inserter, and what you're seeing here is force over time. And this would be when we lower it down, when we make initial contact, force would rise until we puncture through. And so we're looking at what is that maximum force, given all these different parameters: speed, tip shape, electrode spacing, etc. And this is in process of being published right now. But the outcome of this was that we determined insertion speed of 4 to 4.5 millimeters was the best, given this design space.
4.5 millimeters
per second. What we wanted to do was come up with a recommendation for all of our users. So what we did is analyzed all of that, and that's the sweet spot. So that could be fine-tuned specific to a particular array, but we didn't go down that. We didn't have a protocol for every design.
You have speed and you have depth too. You have depth as well. How far would you go in?
Yeah, so like this one is an interesting, so we used a high-speed camera to correlate what's happening with the data. So in this case, you see here's initial touchdown, increase, so there's some dimpling there, and then it punctures through, and then there's a lowering of the force, and then this is the advancement of the electrode to the point where the platform touches then. So there's tissue drag as you're advancing it. Once the platform hits, then you stop, and then the stop and release, and then the force goes down.
Immediately after touchdown, so it stops.
Yeah, in this study, yeah. So what we recommend, and this came out of we were talking yesterday. So once the array went down and was in place, and we'll go through this. There's a process of disconnecting the vacuum, and then withdrawing the driver. But once it touches down, they would immediately start their clock, and at 30 seconds, that needs to be out of there. Beyond 30 seconds is where they start to get concerned about permanent, irreversible brain damage because of cutting off the blood flow to that area of the brain.
So the inserter needs to go out.
Yeah. And this is important too when you think about closing up the craniotomy, and compression is a major deal if you don't really appreciate it. I mean, it can it can kill the tissue just by cutting off starving it from blood flow.
Are you taking into account the blood vessels, and then which one you should avoid, and then which one you shouldn't?
Yeah, good question. So in this study, we were avoiding major vessels, of course. We don't want to cause any bleeding. There was enough, our N was high enough that we were hopeful that, any variability based on, vessels you couldn't see was sort of washed out of the data. Yeah, the other thing, to your point, that we've noticed just through observation is the pia, actually thickens as you get closer to a vessel. And so there's a point at which, you could miss the vessel, but you're still too close, that the pia is too thick, and you'll have a difficult time inserting the array. So we've seen cases where, 14 or 15 out of the 16 shanks appear to go in, but you see a little tiny dimpling, and as soon as you release your driver, it pops out because of that, the dimpling over that thickened pia. So it's something that, just to be mindful and as you're planning things. So this is a new development, these sharpened, what we call sharpened. The standard off-the-shelf probe looks like this. So these are, they're planar structures that are etched to a point. So they're a point in one plane, but then they have like a chisel tip. So the tip doesn't come to a point. It's a flat edge. It's 50 microns. And that's what you're seeing here. But what we've done is developed new processes to actually bring the tips to a point. And that's been a huge improvement as far as the insertability of these go. Okay. And by default now, all the matrix arrays come with these new sharpened tips. So it's not something that you have to specify.